Well, that's a rather complicated question. So I would say that some countries in Europe are doing really, really well, especially the countries in the western parts of Europe are quite far along when it comes to achieving the Sustainable Development Goals. But the further east you go in the WHO European region, the bigger the challenges are. So I would say in terms of reaching some of these testing and treatment targets, I would say in the full region, around 1 in 5 are not aware of their HIV status, and the goal is to be at 95%. So we have major strides to do in the European region as a whole, but again, there are huge inequities in our region, whereas in the Western Europe, we're very close to reaching these targets, whereas those numbers are much further away in the eastern parts of the region. One of the targets that we have is to reach a 75% reduction in HIV new infections from 2010, and there we're doing really bad as a region as a whole, where we're seeing actually an increase of around 30–40% over the past decade in the wider European region. In the EU as a whole, I think we are seeing a decline of around 24% over the past decade, which is good, but it's quite far away from the 75% target. Well, I see 4 main priorities that we need to do. One is primary prevention programs. As I said just now, we are seeing an increase of new infections in the region, so therefore we need to scale up primary prevention programs like pre-exposure prophylaxis for those who need it. We need to make needle and syringe programs available, and all these prevention programs we need to do in combination. There's not one tool that works for all. The second priority is testing, right? So 20% of the population in the European region are unaware of their HIV status. So that means we have to scale up testing programs to address that issue. The third priority is putting people on treatment. So once they are diagnosed, they need to be linked to care and put on treatment as soon as possible. A third of the people who are diagnosed in our region are not on treatment currently, and most countries have policies in place where they say they should be on treatment as soon as possible. So that's a major priority for our region. And lastly, I would say addressing the issue of stigma is going to be critically important to achieve all of these targets. And we know that stigma in the community is quite high. A lot of people are avoiding healthcare services because they are afraid that they will be treated differently in the healthcare setting. So stigma is going to be a major priority.